Hey everyone, it is the first day of pre-AEP, October 1st. And as you can imagine, this morning I woke up and I stretched and I told my wife that I love her, and then I eventually got to my phone. No, just kidding. I woke up, I reached for my phone, I immediately went to Medicare.gov, I started plugging in prescriptions into the Plan Finder because I want to know, what does 2025 look like? So I started with Eliquis and Ozempic, two very expensive medications, using the brand names only because Eliquis has a generic, but using Eliquis brand name and Ozempic brand name. Of course, Ozempic only comes in brand. And I wanted to see what the costs were going to be. Well, the first plan came up in the area I was searching, and it said $360 a year. And I thought, whoa, that's really cheap for Eliquis and Ozempic, total $360 a year on an MA plan. And I thought, wow, that's really, really low. So then I went to the details to see what the payments would be throughout the year, and I was shocked to see that this person was paying $80, would pay $80 for 4 months, $40 on the 5th month, and then $0 for the rest of the year. And I thought, how could they be maxing out at $360? It's supposed to be a $2,000 maximum out of pocket, right? How could they be maxing out at $360? And what is going on here? Then I took that same drug list and put it over into a prescription drug plan, standalone PDP, and the prices were more like $2,000, $2,500 for the year when you count the monthly premium, and that's more what I was expecting out of an MA plan. So then it took me down this whole rabbit hole where I realized everything we've been told is only part of the truth and mostly missing a very critical part of the information. So I started with ChatGPT. ChatGPT. What counts towards the $2,000 maximum out of pocket on a prescription drug plan in 2025? Oh, just the things the member pays. And I'm like, well, what about what's being paid behind the scenes? Does that count? No, it doesn't count. Then I Googled it. And the Gemini AI pops up, and plus a bunch of Google articles. Same thing. No, that's not how it works. What counts towards it is just what the member pays. I'm like, no, that can't be right. Oh, and with ChatGPT, I took the Medicare.gov download, I copied everything from Medicare.gov to show it exactly what I was talking about, put it into ChatGPT, and it said, this just illustrates that this person must have some extra help, like low-income subsidy. Let me tell you about low-income subsidy. I was like, no, I know what I did. That's not it. So then I started digging around, went through a whole bunch. I found Medicare.gov articles, Medicare.gov implementation guides for health plans, and it doesn't spell it out. It does not spell it out. It says, if you've been following this long enough, maybe you understood it, right? Clearly health plans did, but it says these, drug manufacturer discounts do not count toward the maximum out of pocket. Only what the member pays counts toward the maximum out of pocket, and some of the things that counted in the past. Well, some of the things that counted in the past is hardly a good explanation for us as insurance agents. So finally, after digging through some of the carrier websites and carrier portals, I found some other documents. And this was an interesting one. I'm not going to talk about which carriers I'm drawing from, but I've got two different documents here. One says, members' true out-of-pocket accumulation may differ from their actual out-of-pocket costs. I was like, okay, that would be good to know. And then listen to this one. Troop calculations will happen in the background. Agents and consumers do not need to know how to calculate the costs, but should know that troop accumulation may differ from what the member pays out of pocket. Agents and consumers do not need to know how to calculate the costs. Really? Really? That was my reaction. Really? No, I need to know. I can't look like a fool telling someone your maximum out of pocket is going to be $2,000, and then I run their medications and their maximum out of pocket is $360? How does that work? So finally, I found this explains it very clearly. Why isn't this on Medicare.gov? Go to Medicare.gov. It does not explain this. Quote, the amount that is applied towards a member's troop is the greater of the amount paid by the member based on their plan's design, or the cost share that the member would have paid under Medicare's defined standard Part D. That's pretty clear now. Why isn't that on Medicare.gov? So it's the greater of the two. If your copay is more than Medicare's defined standard PDP benefit, then that counts. If the benefit is more than your copay, then what you would have paid under the standard benefit counts. So this is kind of crazy now. If you're on a Medicare Advantage plan that has no deductible, guess what? The deductible still counts towards your maximum out of pocket. If you're on a plan that has a zero copay on a tier, that should be so the standard benefit is a deductible and then 25% coinsurance in the standard, 25% coinsurance in the second phase. So almost everyone is going to get to the $2,000 max without spending $2,000. I mean, this is revolutionary and something that should have been explained. So in this example that I have here, this person has a member with, this is an example of $1,000 medication. They have $1,000 medication, they're on a plan that has no deductible. Well, the full deductible that they would have paid still counts towards the $2,000 max, even though they're not paying it. Then 25% of the $1,000 counts each time. So on $1,000, that means every time they fill their prescriptions, $250 is being added towards their maximum out of pocket. But they have a copay, let's say, of $47. They're paying $47, but $250 is being added to the maximum out of pocket. And so you could hit the maximum out of pocket if you're on a plan that you're taking a medication that costs $1,000. And let's say it's a tier 3 and it's $47 a month and there's no deductible on some Medicare Advantage plan. Not that there are a lot of plans like this. A lot of plans do have the deductible. But the ones that I ran, this example played out true. Well, you could be paying $47 a month. You would only have to pay that if it's a $1,000 medication for 1, 2, 3, 4, 5, 6, 7. By the 7th month, you've hit the $2,000. You've only spent $329. And now you're in catastrophic coverage and pay zero for the rest of the year. I mean, this is absolutely crazy. So you can see why the cost of these plans increased so much, but of course most of that cost is being borne by the federal government and insurance companies, even though it was not supposed to be. Now, when I looked at prescription drug plans, a couple of things became very obvious. A few years ago, it used to be that we had 30, 40 prescription drug plans and a dozen or maybe 24 Medicare Advantage plans. Well, it's completely flopped. Now in most states, you'll see maybe 14 prescription drug plans, but you'll see dozens and dozens of Medicare Advantage plans. When you look at the prescription drug plans, most of them are following more closely the standard benefit. And so I took the same medications, Eliquis and Ozempic, in the same area where I found a $360 maximum that a member would pay for their Eliquis and Ozempic for the year. On a prescription drug plan, the very best case scenario was $1,800. And most, when you included the plan premium, were around $2,200 to $2,800 a month. I mean, it's a massive swing. It's like a $2,000 a year swing to be between a prescription drug plan and a Medicare Advantage plan in this scenario. So how that plays out in terms of the Medicare Advantage, Medicare Supplement debate and where people go, I think it again pushes people more towards Medicare Advantage because their prescription drug costs are so much lower, their monthly premiums are so much lower. But of course, for those who want to have the freedom and the access to go anywhere, then a Medicare Supplement, of course, is unrivaled in that way, but will be even more expensive for people. So that was quite a revelation today. I hope this video helped you to understand what's going on. Just remember, the standard benefit is what counts, not what the member is paying. If the member is paying less than the standard benefit, then the standard benefit still counts towards that person's maximum out of pocket and will get them through to catastrophic coverage.